Clarifying and managing expectations around blood tests for pancreatic cancer is vital. It directly addresses a common point of confusion and anxiety for patients and their families. Dr. James from Pancreatic Cancer Warriors here, looking to help you understand a critical piece of the diagnostic puzzle. When we talk about blood tests for pancreatic cancer, the short answer is, they are a crucial piece of the puzzle, but not a standalone diagnostic tool. Think of them as important clues, not the final verdict. We use them as a starting point, to guide our investigations and inform our understanding, but never as the finish line itself. They paint a part of the picture, prompting us to look deeper and assemble the full diagnosis. The most well-known and often discussed tumor marker in this context is CA19-9. While elevated levels of CA199 can certainly be a red flag, signaling a potential issue, it's essential to understand that it's not a perfect test, nor is it exclusive to pancreatic cancer. The body is a complex system, and a single number rarely tells the whole story. For instance, some individuals who genuinely have pancreatic cancer might present with completely normal CA199 levels. Conversely, there are numerous other, often non-cancerous conditions that can cause this marker to rise, such as pancreatitis, which is inflammation of the pancreas, or a blockage in the bile duct. This demonstrates why relying solely on CA199 can be misleading and emphasizes the need for a broader diagnostic approach. Beyond specific tumor markers, blood tests also play a crucial role in assessing general health and identifying symptoms that point towards pancreatic issues. For example, we frequently look for bilirubin levels in the blood. When these levels are high, they cause a distinct yellowing of the skin and eyes, a condition we call jaundice. This physical manifestation is a key sign that something is obstructing the normal flow of bile, often indicating a blockage in the bile duct. In many cases, particularly with pancreatic cancer, this blockage can be caused by a tumor growing in the head of the pancreas, impeding the bile's path. Identifying jaundice through elevated bilirubin is a significant indicator that warrants immediate and thorough investigation. Liver function tests, or LFTs, are another critical component of the blood test panel we examine. These tests provide insights into the health and functioning of your liver. They can show us if the liver is under stress or not operating optimally. This stress might occur for several reasons related to pancreatic cancer. If the cancer has spread from the pancreas to the liver, the LFTs would likely reflect that damage. Additionally, even if the cancer is confined to the pancreas, a pancreatic tumor can sometimes cause a backup or inflammation that secondarily affects liver function, leading to abnormal LFT readings. So, while not directly diagnosing pancreatic cancer, LFTs offer valuable clues about the body's overall response and potential complications. The true power and most insightful use of these blood tests, whether it's CA199, bilirubin or LFTs, comes from observing the trend over time, rather than focusing on a single measurement. A snapshot in time might give us some information, but seeing how these numbers change and evolve paints a much clearer and more meaningful picture. For instance, if a patient has undergone surgery for pancreatic cancer, a steadily rising CA19-9 level in subsequent tests can be a significant and concerning sign of recurrence, indicating that the cancer may have returned or spread. This longitudinal perspective allows us to monitor disease progression, assess the effectiveness of treatments, and make informed decisions about ongoing care. It's about understanding the dynamic narrative these numbers tell. Blood tests are like a vital piece of the diagnostic puzzle. They provide important information and guide our next steps, but they are never the whole picture. Just like one piece can't complete a puzzle, no single blood test can definitively diagnose or rule out pancreatic cancer. We combine these results with imaging scans, biopsies, and your overall clinical presentation to form a comprehensive understanding. Always remember, the goal is to gather all the clues to give you the most accurate diagnosis and the best possible care. For more information and support, this is Dr. James from Pancreatic Cancer Warriors. We're here to help you navigate this journey with clarity and confidence.